Today marks 1 year since the first COVID-19 case hit Wichita County, and we're reflecting on how the past year has altered the lives of so many in our area. We start with this special report as PJ Green speaks with city officials about the city's response and how they plan to move forward.
The Wichita Falls, Wichita County Public Health District reports the first confirmed case of COVID-19 in Wichita County.
Almost 2 months after the first COVID-19 case hit the U.S., a case was confirmed in Wichita County on March 18th.
Public Health Director Lou Kreidler says the victim and spouse flew into DFW, then drove to Wichita Falls, and the only contact was with others through the medical visit. Now, victims...
To get that phone call that we had our first positive case, it's a little scary, a little, not knowing what it was going to look like.
The 2 cases have turned to 10. We were being flooded with a lot of data. So when we first found out, you start looking at these charts, people were predicting kind of what the pandemic was going to look like. For me, was trying to make sure that we weren't going to look like those charts.
Just a little over a week later, City Council approved a shelter-in-place order on March 27th. Then Wichita County Judge Woody Gossam placed the county under the same order on March 30th. As city and county officials made amendments to their orders, CDC guidelines and mandates from Governor Greg Abbott began an ongoing battle on what local leaders could and could not enforce.
Because we were getting mixed messages, honestly, from the state. They would tell us, okay, everybody should wear a mask. It's the best science, the best practice. But yet they would say you can't really enforce it. So, we didn't have any teeth. If you will, and it made it very difficult to enforce.
The information was continuously changing. Guidance would come out from CDC or guidance would come out from DSHS, but oftentimes we would already be kind of faced with a problem or a conundrum, and that guidance wouldn't be there.
While there was confusion, everyone adjusted. Churches had services outside in cars, restaurants were strictly pickup and curbside, and many people did their part to make masks. As the shelter-in-place orders expired during the summer, residents slowly got back outside to enjoy the weather. But as 2020 slowly crept into the holiday season, case numbers also rose.
The goal was not to inundate the hospitals. We knew COVID was going to hit our community. We knew it was going to spread through our community. I think the goal was to have it spread at a lower even rate rather than these huge spikes. These huge spikes are going to inundate the hospital system, and I think that overall we knew that was going to be the goal.
United Regional was on the brink of that as officials from the hospital urged the community to take precautions in October. That month had more than 1,100 active cases after the county only had almost 2,000 total cases from March to late September. The spike only increased during the holiday season, where the county saw a peak of more than 3,000 active cases in January.
I can remember being in this room and finding out at 4 o'clock in the afternoon that we had 10 cases that came in, and telling staff that they couldn't go home because we had to investigate them. And then I can remember just as vividly when we got 100 cases in a day and then 200 cases in a day. We couldn't hire enough individuals fast enough to keep up the pace.
But as the vaccine slowly rolled out into the community, late January began the decline that everyone was waiting for, and provided some light to a dark time in history.
I think that given the cards we were dealt, we played them very well. It was difficult because, again, we were navigating, changing seas from the state and federal level. But I think on balance, we did pretty well.
With Governor Abbott fully opening the state and students on spring break, these officials urge everyone to wear a mask and continue the declining numbers in 2021.
It's great because I always thought this was going to be about a 2-year process, but as it's more manageable, as the state opens back up for council, it's a huge relief because we have a lot of business to get done with the city of Wichita Falls.
And we know that the pandemic is not over. It is merely on the tail end of where we're at in this process, and we need to keep it there. We don't need to do anything to push us back.